to this gentle, peaceful space. Let yourself settle in completely. Take a deep breath, filling your lungs fully, and then release it with a soft sigh. Allow any tension you're carrying to simply dissolve. Today, we're going to explore the profound connection between your inner calm and your skin's inflammation, and how cultivating peace within can create peace on your skin. Inflammation is at the root of nearly every skin concern you might experience. Acne, redness, sensitivity, premature aging, rosacea, eczema. All of these involve inflammation at some level. While topical treatments have their place, there's a powerful truth that's often overlooked. Your emotional state directly influences inflammation throughout your body, including your skin. When you learn to stay calm, you literally reduce inflammation in your skin. This isn't mysticism or wishful thinking. This is biology. The connection between your mind and your skin is mediated by your nervous system, your immune system, and your hormones. These systems are in constant communication, and your emotional state is part of that conversation. Let's explore how this works and, more importantly, how you can use this knowledge to improve your skin. Let's begin by understanding what inflammation actually is and why it happens. Inflammation is your body's natural response to perceived threats, injury, infection, irritation, or stress. When your immune system detects a threat, it triggers an inflammatory response. Increased blood flow to the area, immune cells rushing to the scene, the release of inflammatory molecules called cytokines. In the short term, this is protective and healing. A cut on your skin becomes inflamed as your body works to prevent infection and repair the damage. This is acute inflammation, and it's beneficial. The problem arises with chronic inflammation, low-level, persistent inflammation that continues long after any real threat has passed. This chronic inflammation damages healthy tissues over time. In your skin, chronic inflammation breaks down collagen, impairs barrier function, triggers excessive oil production, creates sensitivity, and accelerates aging. It's the enemy of healthy skin. Here's where your emotional state enters the picture. When you're stressed, anxious, or emotionally agitated, your body perceives this as a threat. Your stress response activates, releasing cortisol and other stress hormones. These hormones trigger inflammatory pathways throughout your body. Your immune system shifts toward a pro-inflammatory state. This happens whether the stress is from a real physical danger or from worry about your to-do list. Your body responds to both with inflammation. Chronic stress means chronic inflammation. Day after day of elevated stress hormones keeps your entire system, including your skin, in an inflamed state. This manifests as reactive, sensitive skin that breaks out easily, heals slowly, and ages prematurely. Now consider the opposite state, calm. When you're genuinely calm, not suppressing emotions, but truly peaceful, your stress hormones decrease. Your parasympathetic nervous system activates. Anti-inflammatory processes engage. Your immune system shifts toward balance. Inflammatory markers in your blood decrease. This internal shift manifests externally in your skin as reduced redness, fewer breakouts, better healing, and improved overall health. Let's explore the specific ways that emotional agitation creates skin inflammation. First, stress hormones, particularly cortisol, directly increase inflammation. Cortisol triggers the release of pro-inflammatory cytokines. These molecules create and sustain inflammatory reactions throughout your body. In your skin, This inflammatory cascade can trigger or worsen conditions like acne, rosacea, psoriasis, and eczema. Second, stress disrupts your gut microbiome, and your gut health directly affects your skin. When you're stressed, your digestion suffers. Your gut becomes more permeable, allowing inflammatory molecules to enter your bloodstream. This systemic inflammation affects your entire body, including your skin. The gut-brain-skin axis is a real and powerful connection. Third, stress impairs your skin's barrier function. Your skin barrier is your first line of defense against irritants and allergens. When stress hormones weaken this barrier, your skin becomes more vulnerable to inflammatory triggers. Things that wouldn't normally bother your skin suddenly cause reactions. Fourth, stress affects your sleep, and poor sleep increases inflammation. During deep sleep, your body performs essential repair and regeneration, including reducing inflammation. When stress disrupts your sleep, you lose this crucial anti-inflammatory recovery period, and inflammation accumulates. Fifth, stress often leads to behaviors that increase skin inflammation, touching your face, picking at skin, neglecting your skincare routine, eating inflammatory foods for comfort, or overusing harsh products in an attempt to fix stress-induced breakouts. These behaviors compound the direct inflammatory effects of stress itself. Now let's explore how staying calm actively reduces inflammation and heals your skin. When you cultivate genuine calm through meditation, breathing practices, mindfulness, or any method that truly settles your nervous system, you activate powerful anti-inflammatory mechanisms. Your stress hormone levels decrease. Your body releases anti-inflammatory molecules. Your immune system rebalances. Blood flow improves, delivering healing nutrients to your skin while removing inflammatory waste products. Your sleep improves, allowing more complete repair and inflammation resolution. Your gut health often improves as stress-related digestive issues ease. Your skin's barrier function strengthens as stress hormones stop undermining it. You make better choices about skincare and lifestyle because you're operating from a place of clarity rather than anxiety. The visible effects can be remarkable. Redness decreases, reactive skin calms down, breakouts reduce in frequency and severity, healing accelerates. Your skin simply looks and feels healthier, often without changing any topical products. So how do you cultivate calm in a way that actually reduces inflammation rather than just suppressing stress temporarily? First, understand that true calm isn't the same as distraction or numbing. Scrolling social media, watching television, or having a drink might temporarily take your mind off stress, but they don't actually shift your nervous system into a calm state. In fact, some of these activities can increase agitation. True calm comes from practices that genuinely activate your parasympathetic nervous system and allow your body to release held tension. Meditation is one of the most powerful tools for reducing inflammation through calming the mind. You don't need elaborate techniques. Simply sitting quietly, focusing on your breath, and gently returning your attention to your breath whenever your mind wanders. This simple practice, done regularly, reduces stress hormones, lowers inflammatory markers in your blood, and creates a baseline of greater calm in your life. Start with just 5 or 10 minutes daily. Sit comfortably, close your eyes if that feels right, and breathe naturally while observing your breath. When thoughts arise, and they will, don't judge them or yourself. Simply notice and return your attention to breathing. This practice trains your nervous system to settle more easily, which over time means less chronic activation of inflammatory pathways. Mindfulness throughout your day extends meditation's benefits. Mindfulness simply means paying attention to present moment experience without judgment. When you're washing dishes, actually wash dishes. Feel the water. Notice the movements. Be fully present. Take a deep breath in through your nose and slowly release it. Let your shoulders drop away from your ears. Feel the tension melting from your face. Today we're going to explore something that touches every aspect of our skin health, something we all experience but often underestimate in its impact on our complexion: stress. Before we dive in, let's take another moment together. Breathe in for 4 counts, hold for 4, and release for 6. Feel your body settling into this moment. There's no rush. Everything you need to know will unfold naturally. Stress and skin are connected in ways that might surprise you. When you experience stress, whether it's a looming deadline, a difficult conversation, or ongoing worry about something in your life, your body responds with a cascade of chemical reactions. Your adrenal glands release cortisol, often called the stress hormone. While cortisol serves important functions in short bursts, chronic elevation affects your skin in multiple ways. First, elevated cortisol increases oil production in your skin. Your sebaceous glands respond to stress hormones by producing more sebum. This is why many people notice breakouts appearing during particularly stressful periods. It's not your imagination, and it's not a coincidence. Your skin is literally responding to what's happening in your mind and body. Stress also compromises your skin barrier. That protective outer layer we've talked about in other sessions, the one that keeps moisture in and irritants out, becomes more permeable under chronic stress. Water escapes more easily. Irritants penetrate more readily. Your skin becomes more reactive, more sensitive, more prone to conditions like eczema flares or rosacea episodes. The inflammatory response in your body intensifies during stressful periods. Inflammation is your immune system's way of protecting you, but chronic inflammation damages skin cells, breaks down collagen, and accelerates visible aging. Those stress lines we joke about, they're partially created by this ongoing inflammatory process affecting the structures that keep skin firm and resilient. Stress disrupts your sleep patterns, and poor sleep affects skin profoundly. During deep sleep, your body repairs damage, produces new skin cells, and balances hormones. When stress keeps you awake or makes your sleep shallow and restless, your skin misses these crucial repair windows. Dark circles appear. Fine lines seem more pronounced. Your complexion looks dull and tired because, quite simply, your skin is tired. Your stress response also affects blood flow. During acute stress, blood moves away from your skin toward your muscles and vital organs, part of the ancient fight-or-flight response. With chronic stress, your skin receives less oxygen and nutrients from reduced circulation. This contributes to that flat, lifeless appearance. Stress-affected skin often displays. Stress changes your behavior in ways that impact skin. You might touch your face more, picking at perceived imperfections, or simply fidgeting. You might skip your skincare routine when overwhelmed, or conversely, overtreat your skin trying to fix stress-related breakouts quickly. You might reach for sugar or processed foods for comfort, affecting your skin from the inside out. The relationship runs both ways. Skin concerns themselves create stress, forming a difficult cycle. A breakout causes anxiety, which increases cortisol, which worsens the breakout. Understanding this connection helps us approach both stress and skin with more compassion and strategic intervention. Managing stress for skin health doesn't mean eliminating all stress from your life. Some stress is inevitable, even occasionally useful. Instead, focus on building resilience and developing practices that help your body process stress more effectively. Start with breathing. It sounds simple, perhaps too simple, but proper breathing directly counteracts your stress response. When you breathe slowly and deeply, activating your diaphragm, you signal your nervous system that you're safe. Your heart rate slows, cortisol levels drop, inflammation decreases. Try this throughout your day, especially before and during stressful situations. 5 deep breaths can shift your entire physiology. Movement helps process stress hormones. You don't need intense exercise, though that can help. Simply walking, gentle stretching, or dancing to music you love helps your body metabolize stress chemicals. Movement also improves circulation to your skin, bringing fresh oxygen and nutrients while carrying away cellular waste. Sleep protection becomes crucial. Establish boundaries around your rest time. Create a wind-down routine that signals to your body that sleep is approaching. Keep your bedroom cool and dark. Put your phone away an hour before bed. These aren't luxuries during stressful times, they're necessities. Your skin repairs while you sleep, and protecting that repair time protects your complexion. Consider your stimulant intake. Coffee and energy drinks feel helpful when you're stressed and tired, but they keep cortisol elevated and can interfere with sleep quality. If you're experiencing stress-related skin issues, try reducing caffeine, especially after early afternoon. Notice whether your skin responds positively. Nutrition supports stress resilience. Foods rich in omega-3 fatty acids like salmon, walnuts, and flax seeds help modulate inflammation. Colorful vegetables provide antioxidants that counter oxidative stress. Magnesium-rich foods like dark leafy greens, nuts, and whole grains support your stress response system. You're not just feeding your body, you're providing raw materials for managing stress at a cellular level. Mindfulness practices help break the stress skin cycle. When you notice stress arising, pause. Name what you're feeling. Acknowledge it without judgment. This simple act of awareness often reduces stress intensity. Regular meditation, even just 5 or 10 minutes daily, changes how your brain processes stress over time. Your skin benefits from these neurological shifts. Social connection matters. Isolation intensifies stress responses, while genuine connection with others, even brief interactions, helps regulate your nervous system. Reach out to friends. Have real conversations. Share what you're experiencing. This isn't weakness, it's biological wisdom. We're meant to co-regulate with other humans. For your skincare routine during stressful times, keep it simple and consistent. Stress is not the moment to try new products or aggressive treatments. Stick with gentle, proven basics. Cleanse thoroughly but kindly. Use a simple, effective moisturizer. Don't skip sunscreen even when you feel overwhelmed. These small acts of self-care send powerful messages to your nervous system. Consider adding calming ingredients to your routine. Centella asiatica, also called CK, has adaptogenic properties that help skin cope with stress. Niacinamide supports barrier function and can help with stress-related oil production. Oat extract soothes reactive skin. Green tea provides antioxidants that counter stress-related inflammation. These aren't magic solutions, but they're supportive allies during difficult periods. Pay attention to how you touch your face. Stress often increases unconscious face touching and picking. When you notice this happening, gently redirect the impulse. Keep your hands busy with a stress ball or fidget toy. If you struggle with skin picking, consider working with a therapist who specializes in body-focused repetitive behavior.
Acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy. If you're on acne medications like isotretinoin, requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during puberty, stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is more sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring more careful barrier support during acne treatment. Sensitive skin becomes more common with age.
Khó chịu rồi nói chị nha. Thả lỏng. Đúng rồi. Nhìn chút nhiều. Rồi cố gắng thêm xíu đây nha.
Hello, and welcome back to this peaceful space. Take a gentle breath with me. Breathe in slowly and release softly, letting go of any tension. Today, we're going to explore something absolutely fundamental to skin health, your skin barrier, and how to keep it strong, healthy, and resilient. Your skin barrier might be the most important aspect of skin health that you've never really thought about. It's invisible, it works quietly in the background, and when it's functioning well, you barely notice it. But when it's compromised, suddenly everything becomes difficult. Your skin becomes sensitive, reactive, dry, and uncomfortable. Understanding and protecting your skin barrier is one of the most important things you can do for your skin. So what exactly is the skin barrier? Technically called the stratum corneum, it's the outermost layer of your skin. Think of it as a brick wall. The bricks are your skin cells called corneocytes, and the mortar holding them together is made of lipids, including ceramides, cholesterol, and fatty acids. This structure creates a protective barrier that does two crucial things. It keeps water and moisture in your skin, and it keeps irritants, bacteria, and environmental stressors out. When your barrier is healthy and intact, your skin feels comfortable, looks smooth, and functions optimally. Water loss is minimal. Irritants can't easily penetrate. Your skin maintains its natural pH balance. You experience few problems because your barrier is doing its job beautifully. But when your barrier is compromised, everything changes. Gaps form between the cells. Water escapes more easily, leaving your skin dehydrated. Irritants penetrate more easily, causing sensitivity and inflammation. Your skin becomes vulnerable, reactive, and uncomfortable. Many common skin problems, dryness, sensitivity, breakouts, premature aging, can be traced back to a compromised barrier. The good news is that your skin barrier is remarkably resilient. It can repair itself when given the right support, and you can actively maintain its health through gentle, consistent care. Let's talk about how. First, understand what damages the barrier. Harsh cleansers are one of the biggest culprits. Cleansers with strong surfactants, especially sodium lauryl sulfate, strip away not just dirt and oil, but also the essential lipids your barrier needs. That tight, squeaky clean feeling after washing, that's actually your barrier being damaged. Hot water also strips lipids and compromises the barrier. Over-cleansing, washing your face multiple times a day, gradually wears down the barrier faster than it can repair itself. Excessive exfoliation is another common cause of barrier damage. Physical scrubs with rough particles, harsh brushes, or overzealous use of chemical exfoliants all strip away layers of protective cells. Used occasionally and gently, exfoliation can be beneficial. Used too frequently or aggressively, it destroys your barrier. Environmental factors damage the barrier too. Extreme weather, very cold, very hot, very dry, very windy, all stress the barrier. Indoor heating and air conditioning remove moisture from the air, which draws moisture from your skin. Pollution and UV radiation create oxidative stress that degrades barrier lipids. Your barrier is constantly working to protect you from these stressors, and sometimes the assault is overwhelming. Certain skincare ingredients, especially in high concentrations, can compromise the barrier. Retinoids, strong acids, high percentage vitamin C, and other potent actives can be irritating if your barrier isn't strong. This doesn't mean you can't use these ingredients. Many of them offer significant benefits, but they must be introduced gradually. used appropriately, and combined with barrier-supporting care. Even your lifestyle affects your barrier. Poor sleep disrupts your skin's natural repair processes, which primarily happen overnight. Chronic stress elevates cortisol, which can weaken the barrier. Inadequate nutrition deprives your body of the building blocks it needs to maintain healthy skin. Smoking and excessive alcohol consumption both damage the barrier and impair its ability to repair. Now let's talk about how to protect and strengthen your barrier. It starts with gentle cleansing. Choose a mild, creamy, or low foaming cleanser that cleans without stripping. Use lukewarm water, never hot. Cleanse thoroughly but gently, using your fingertips with light pressure. And don't over-cleanse. Once a day in the evening is often enough, with just water or a very light cleanse in the morning. After cleansing, pat your skin dry gently. Don't rub, which creates friction and stress on your barrier. Use a clean, soft towel with pressing motions to absorb water. Moisturizing is crucial for barrier health. A good moisturizer does several things. It provides water to hydrate your skin. It supplies lipids to reinforce the barrier structure, and it creates an occlusive seal to prevent moisture loss. Look for moisturizers with ceramides, cholesterol, and fatty acids. These are the exact lipids that make up your barrier, so applying them topically helps reinforce and repair it. Humectants like hyaluronic acid and glycerin attract water to your skin. Emollients like plant oils and shea butter smooth and soften. Occlusives like petrolatum and dimethicone seal everything in. The best moisturizers for barrier health contain a combination of all these types of ingredients. Apply your moisturizer to slightly damp skin. This traps extra water in your skin and enhances the moisturizer's effectiveness. Don't wait until your skin is completely dry. The few minutes right after cleansing are golden for moisturizing. Consider adding a facial oil or a heavier occlusive at night. Your skin does most of its repair work while you sleep, and providing extra barrier support during this time can be especially beneficial. Products with squalane, jojoba oil, or even plain petrolatum can create a protective seal that prevents nighttime water loss. Sunscreen protects your barrier in multiple ways. It prevents UV damage, which degrades barrier lipids and creates oxidative stress. It physically shields your skin from environmental assault. Daily sunscreen use is one of the most important things you can do for long-term barrier health. Let's talk about what to avoid. Skip products with alcohol denat, or SD alcohol, high on the ingredient list. These are drying and irritating. Avoid harsh scrubs and aggressive physical exfoliation. Be cautious with strong actives, especially if your barrier is already compromised. Avoid hot showers and baths. Don't overwash your face. If you use active ingredients like retinol or acids, introduce them slowly. Start with a low concentration once or twice a week, then gradually increase frequency as your skin adapts. Always buffer active ingredients with moisturizer. Apply moisturizer first, let it absorb, then apply the active. Or apply the active and immediately follow with moisturizer. This reduces irritation while still allowing the active to work. Pay attention to your environment. If you live in a dry climate or use heating or air conditioning, run a humidifier to add moisture back to the air. This prevents your environment from constantly pulling moisture from your skin. In very cold or windy weather, protect your face with a scarf and apply a richer moisturizer or an occlusive like petroleum jelly before going outside. Your diet supports barrier health from the inside. Essential fatty acids from fish, nuts, and seeds provide building blocks for barrier lipids. Antioxidants from colorful fruits and vegetables protect against oxidative damage. Adequate protein ensures your body has the amino acids needed to build skin cells. And of course, drinking enough water keeps your entire body, including your skin, hydrated. Sleep is when your barrier repairs itself most actively. During deep sleep, your body increases cell turnover and barrier repair processes. Aim for 7 to 9 hours of quality sleep each night. Your barrier and your overall health will benefit enormously. Stress management matters too. Chronic stress impairs barrier function through multiple pathways. Practice stress reduction techniques that work for you. Deep breathing, meditation, gentle movement, time in nature, connection with loved ones. When you care for your mental health, you're also caring for your skin barrier. How do you know if your barrier is compromised? There are clear signs. Your skin feels tight, dry, or uncomfortable. It looks dull or rough. It becomes more sensitive than usual. Products that normally don't bother you suddenly sting or irritate. You experience increased redness, flaking, or breakouts. Your skin reacts strongly to temperature changes or wind. If you notice, welcome and breathe gently. Today we explore the Jade Roller, a simple, beautiful tool that offers real benefits when used correctly, though perhaps not all the miracles some claim. The Jade Roller is a handheld tool featuring 1 or 2 smooth jade stones mounted on a handle. Typically, there's a larger stone for cheeks and forehead, and a smaller stone for under eyes and around the nose. You roll these cool, smooth stones across your face, following specific patterns. Jade rollers have been used in Chinese skincare for centuries, though their recent popularity surge is modern. Understanding what they actually do versus marketing hype helps you decide if they're worth incorporating into your routine. Let's discuss real jade roller benefits. First, jade naturally stays cool. This coolness feels soothing on skin and helps reduce puffiness, especially around eyes. The cooling effect constricts blood vessels temporarily, reducing fluid accumulation and that puffy look many people wake up with. Second, the rolling massage action promotes lymphatic drainage. When you roll in proper directions following lymphatic pathways, you help move excess fluid away from your face. This reduces puffiness and bloating, creating more defined facial contours. Third, rolling increases circulation. The gentle pressure and movement bring fresh blood to your skin's surface, delivering oxygen and nutrients while removing waste products. This creates a healthy, natural glow. Fourth, the massage feels wonderful and reduces tension. Your face holds stress. Rolling releases this tension, particularly in your jaw, temples, and forehead. This relaxation benefits both your skin and overall stress levels. Fifth, rolling enhances product absorption. When you roll over serums and oils, the massage helps these products penetrate more effectively. Your skincare works better with jade rolling assistance. Now let's discuss what jade rollers don't do, despite marketing claims. Jade rollers will not eliminate wrinkles, dramatically contour or slim your face, tighten loose skin, or replace professional treatments. They provide subtle, temporary benefits, not dramatic transformation. The puffiness reduction is real but temporary. Roll in the morning, look less puffy for a few hours, but puffiness returns gradually throughout the day. Jade rolling doesn't permanently change your facial structure or solve the underlying causes of puffiness. Proper jade roller technique matters for effectiveness. Always prepare your skin first, cleanse, then apply generous facial oil or serum. The roller needs slip. Dry rolling creates friction and pulls skin. Start at your neck, rolling upward from collarbone to jaw, 5 to 10 times on each side. This opens lymphatic drainage pathways. Use light to medium pressure. Jade rollers are gentle tools, not aggressive massage implements. Move to your jawline, rolling from chin toward ear, 5 to 10 times on each side. This releases jaw tension and drains fluid beautifully. For cheeks, roll from beside your nose outward and upward toward temples, 5 to 10 times, covering your entire cheek area. Under your eyes, use the smaller roller with very gentle pressure. Roll from inner corner outward toward temple 5 to 10 times under each eye. This area needs extreme gentleness. The skin is the thinnest on your face. For your forehead, roll from eyebrows up toward hairline, then from center outward toward temples. This releases forehead tension and promotes drainage. Always roll in upward and outward directions, never downward. You're working with gravity, not against it, encouraging fluid to drain properly. How long should jade rolling take? Just 5 minutes provides benefits, though 10 minutes is lovely if you have time. Even 2 to 3 minutes focusing on puffy areas like under eyes helps. When should you roll? Morning is most beneficial for reducing overnight puffiness. Many people keep their roller in the fridge overnight for extra cooling effects in the morning. However, evening rolling is deeply relaxing before bed. Choose whatever fits your routine. How often should you roll? Daily is fine if you enjoy it, though 3-5 times weekly provides noticeable benefits. Consistency matters more than frequency. Let's discuss jade roller care. Clean your roller after every use. Bacteria can accumulate on the stone surface. Wash with gentle soap and warm water. Dry thoroughly. Weekly, do a deeper clean with rubbing alcohol. Store your roller where it won't get dropped. Jade can chip or crack if dropped on hard surfaces. Regarding jade authenticity, many jade rollers aren't real jade, but dyed stone or even plastic. Real jade feels cool to touch, has natural color variations, and is relatively heavy. Extremely cheap rollers are likely fake. While fake rollers still provide the massage benefit, they lack jade's natural cooling properties and may have quality issues. Rose quartz is another popular roller material. It provides the same massage and drainage benefits as jade, but doesn't stay cool as naturally. Choose based on preference. Both work. Some rollers have textured surfaces or multiple stones. These variations are personal preference. Smooth, simple rollers work perfectly well. Fancy features aren't necessary for effectiveness. Common jade rolling mistakes include using too much pressure, rolling downward, using insufficient product, rushing through the motions, and expecting dramatic overnight transformation. For acne-prone skin, jade rolling can help by improving circulation and drainage. However, never roll over active breakouts. This spreads bacteria. Roll on clear areas only, or wait until skin is clearer. For sensitive skin, jade rolling is generally safe with gentle pressure and appropriate products. The coolness can be soothing. However, if you notice increased redness or irritation, you might be pressing too hard or rolling too frequently. For mature skin, jade rolling is lovely. The massage supports circulation and lymphatic drainage without aggressive manipulation. The cooling effect feels particularly soothing on mature, often more sensitive skin. Can jade rolling replace other skincare? No. It's supplemental, enhancing your routine, but not replacing cleansing, treatment products, moisturizer, or sunscreen. Jade rolling is an optional extra that feels good and provides subtle benefits. Will jade rolling give you a facial workout or tighten skin? Not really. The light pressure of rolling doesn't provide enough resistance to significantly strengthen facial muscles or tighten loose skin. It's massage, not exercise. Professional estheticians often use jade rollers as part of facial treatments, combining them with other techniques for enhanced results. Professional use doesn't make rollers necessary for home care, but it does validate their beneficial place in comprehensive skincare. Jade rollers versus gua sha tools. Which is better? Neither is better. They're different. Jade rollers are gentler, easier for beginners, and less likely to cause irritation. Gua sha provides more intensive massage and drainage, but requires more technique and skill. You can use both, alternating based on your needs, or choose one based on preference. The cost of jade rollers varies wildly, from a few dollars to hundreds. Expensive doesn't necessarily mean better. A mid-range roller from a reputable company serves you well. Extremely cheap rollers are likely poor quality or fake jade. Extremely expensive rollers might be marketing markup rather than superior function. As we close, remember that jade rollers are optional tools offering genuine but subtle benefits. They're wonderful additions to your routine if you enjoy the ritual and experience, but they're not necessary for good skin health. The coolness, massage, and moment of self-care have value beyond any dramatic physical transformation. Take a breath, and if you have a jade roller, perhaps enjoy a quick roll now, appreciating the simple pleasure of cool stone on your skin. May your rolling practice be peaceful and beneficial. May you find joy in this gentle ritual. May your skin respond with healthy glow.